presentation. So the question reads, please, am I audible?
Yes, I can hear you. I can hear
All
you.
right, thank you. Yes, the question reads, the woman came to the clinic with history of current feeling of unwellness and generalized umbilicated rashes that was also seen in the inner region. Skin swab biopsy was taken for the rash and awaiting results. She had HIV test done, which has now come out positive. She's the fourth wife of her husband. She had come to the clinic today for the result of HIV tests. Husband was sitting next to her. Talk to her about the result of her test. How will you inform the husband about the state of the wife? And how will you allay the anxiety of the other wives and family members? So for this presentation, being a counseling station, my simulator will be Dr. Hart. I don't know if Dr. Hart is on the call. For
Yeah,
the
I'm here.
wife, why Dr. Okorafor will be the husband. I don't know if Dr. Okorafor is there.
Good morning. Good morning, everyone.
Okay, good morning. Okay. So I'll just start right away. Good morning, Ma.
Good morning. Good morning, doctor.
Oh, good morning. Nice seeing you today. My name is Dr. Joe. I'm one of your doctors in the clinic. Nice seeing you today. How are you doing?
Well, I'm just trying to, I'm not feeling too well now, but well, I'm better. Trying.
Oh, so sorry about that. And I can see somebody with you. Can you introduce him?
Doctor, this is my husband who is our chief.
This is my first time meeting him. You're welcome, sir. You're welcome, sir.
Thank you very much.
All right. So I don't know if this place is convenient for you, or you want us to go somewhere more private.
I think this place is fine. It's okay here.
Okay. Please, can you confirm your name for me, please?
Yes, I'm Mrs. Joy.
Oh, Mrs. Joy. Okay. So
Yes,
if
and
I
this is
call
my
you Joy, is
husband.
that okay?
Okay, that's fine.
All right. Please, how old are you?
I'm 35.
Oh, 35 years old. Okay. Please. So what's your highest level of education, please?
I went to the university. I'm a businesswoman.
Okay.
University.
How many children do you have?
I have two right now.
Oh, okay. All right. I don't know if you are comfortable with the discussion. Go ahead with the discussion.
Well,
Or
doctor.
is there another person you want to be with you apart from your husband?
No, only him.
Okay, all right. Okay. This particular discussion, I will just crave the indulgence of your husband. It will involve me first having some few chat with you first, and maybe later on, we now invite your husband to come in. I don't know if your husband will mind that, please.
I don't
Doctor,
mind.
hope all is well.
Everything is well. There's no problem. Just want to just have some few chats. Don't worry, I will still bring your husband later.
No
Will be
problem.
part of our discussion.
Okay.
So I will just ask all my people to just take your husband to the next room now, so that we can continue that discussion.
Okay, no problem.
All right.
Thank you, sir.
All right. Thank you. Thank you very much. Ms. Joy, have you ever have any thought about what might be the cause of this rash we're having? Have you ever have any thought about what might be the cause?
Doctor, I don't know. I really don't know. You said you were going to do different tests, so I don't know. I'm not sure.
Yes. We take some samples from the skin, and we also collect some blood tests. That last time you came, you remember?
Yes, I did.
And I think one of our counselor was talking to you before one of the tests was collected about one particular test result. You mentioned anything about HIV test result to you, HIV sample to you?
Doctor, my heart is just beating. I am aware of it. You told me about it.
Okay. I know anybody in your show will also be very, apprehensive, want to know what the result will be. But is there any fear? Is there any what's your fear presently? Anything you are expecting?
Doctor, please just tell me the result, please. I'm afraid. I've heard of HIV and I know it's a bad thing, so please just let me know. know it used to kill
Yeah,
people.
so yes, that's what we are here. We're here to if you we can go ahead with the discussion, or you want us to maybe fix another date for this. Thank you.
Let's go ahead. Let's go ahead, please.
So don't worry, I will tell you the result. Just that I may want to ask some few questions before I go ahead and discuss the result with you. I'll be asking some personal questions. I don't know if you don't mind.
It's all right.
Okay. So have you ever heard about this HIV result? Do you know HIV as a virus before? Do you know anything about it? How it is spread?
Doctor, I know it used to kill people and it's gotten from sex.
Okay. So you want to say how many sexual partners do you have?
It's only my husband now. I'm a married
Okay,
woman, no. Doctor.
okay. Yeah, I know. I understand. And what kind of there are two openings, the one in front and the one at the back. I don't know which one do you practice?
Doctor, it's only the normal thing, no. I don't know any other thing we are talking about.
Okay, okay. Do you know if your partner has a test like this done before? For now?
Well, we just did our traditional wedding about a year ago. We had our first child before the wedding, so we've never done any HIV test before.
Okay. You've been sharing needles with anybody or any shops or anybody recently or in the past?
I used to go to the spa, I do all those my pedicure, but they don't use old. We don't share. No, we don't share to the best of my
Okay.
knowledge.
Okay. Have you ever received any blood transfusion recently?
Oh, God forbid, never. Doctor, I don't
Okay.
I don't fall sick. Oh. I'm a very strong
Okay.
person.
And the other wives in the family, do you know patterns? Know if any of them has had a HIV test done before for now?
Ah, doctor, I don't know. We're not staying together. All of us, we have our own house. I don't know. I don't know anything about them.
Okay. Well, as I said earlier, we have the result of the test with me, and I'm very unfortunately, Mrs. Joy, I don't have a good news for you.
Hmm? Doctor, what is it?
I wish I have a better news for you at this time, but sorry, the result is out and come out positive.
It's a lie. Doctor. Eh, so I'm going to die now. Is that what you are telling me now? Doctor.
I can't even imagine what you may be thinking now, or anybody in your shoe will also have this kind of mind. But I want to say that having a positive test is not the end of life and not synonymous with death. A lot of things can be done, and we can actually salvage the situation. So I'll just say you have a positive mindset, and we are here to help you to live this
Hey, so how did I get it now? How did I get it, doctor?
Yeah, it may be difficult to answer, but as I've said, with the various means or the various risk factor for acquiring this infection
If
include
you have 2 minutes more. You have 2 more minutes.
From sex. Apparently, we need to also test your husband and also possible the other member of the family. But we're also aware that other forms of transmission are possible. That's why I was asking you the other time for you had share needles or you have blood transfusion in the past. Those are other way in which people can get it.
Okay, well, doctor, I don't know. So, if my husband do his own test, I don't know.
What we usually do is that you be the one to inform me about this result, and since he's around, it may be a good.
Hey, he will pursue me from the house now.
Well, it doesn't. I understand how you are feeling, but it doesn't really. That's why this kind of setting in the hospital environment, if you give us the permission, we can discuss it so that we're able to also talk to him about the need for to have a test, and also discuss with him that there are various ways in which people can get HIV, not necessarily through sex, and to also reassure that that's not the end of life. That is not the by the time you starting your medications, you live a normal life.
Thank you. Help me, oh doctor. This one, they'll pursue me from my house. Just please, just assist me, please.
So that, yeah, yes. So that's all we are here to. Do you have any other concern about that presently?
I don't want to die. I don't want to die, doctor. Out of my children, I don't want to
Yes.
die.
You can be well assured that by the time we run some tests on you, we want to start you on the medications, and we tell you that many people on these medications when are living their normal life, they don't tend to
These
have.
things on my body, will they go away?
Yes, by the time we start your medication, we suspected because of the widespread nature of the rashes. So by the time you start your medications and the skin rash will go away. And rest assured about that.
Okay.
Okay, so another thing we can do now for you now going forward is to do a confirmatory test to just check again. And after that, we want to run some tests for you to check the level of the virus, to know how hard the virus is, and also to check the immune system of the body. But generally speaking, most of the time when the virus is there, the immune cells tend to go down. So we want to check their level then before we now place you on medications. And when you place you on these medications, we
Your
want
time
to
is up.
advise that you
Time
compliant.
up.
Allow him to round up. Allow him to round up.
Okay. I'll go ahead.
So we want to thank you very much, sir. We want to advise that you comply with your medications, and if you do that, you won't have any. You'll be living your normal life, even with your husband. Generally speaking, initially we'll advise that now you may use some form of barrier method for now. Anytime we're able to start your medications, and by the time you start your medications and the level of the virus in your blood comes down drastically, you can even resume your normal sexual life. That will not be a problem. Is that okay?
Are you sure, doctor? Are you sure? Okay. Okay.
This is what we do. We have a specialized clinic called Heart to Heart where we manage this kind of situation, and I will be introducing to that clinic where you meet people of that have the same kind of challenge. So we have to have a social worker working there. They also do some heart-to-heart talk with you and to also guide you through. So you don't have anything to worry about. Is that okay?
Okay, thank you.
Okay, so I think at this time we also want to run some tests for some other viruses that are also can be contracted to the same means like B and C, and so just to be sure that those ones are not there.
Doctor, do everything. No, check everything. Check everything, please. Check everything.
All right, so we'll make sure we'll do an holistic test for you. At this point, can I call in your husband so that we also discuss with him and want us to do that?
Okay, doctor.
All right. So let me call in your husband. So, Mr. Joy, how are you doing? Sorry for keeping you waiting. You've been discussing to your wife since. Hope you are fine.
Yeah, I'm fine. Thank you. I was wondering what you people were doing inside. I came with her, you sent me away. And I'm like, is that how it is done?
Sorry,
my
brother. Sorry. Just that we just need to, discuss with her with some things, and we're sorry for keeping you waiting. If you don't mind.
So I don't know now. Now I've been living with her.
So,
she's been falling sick and all that and all this. So that was why we came around. So I don't know. Is there any remedy? Is there any hope?
Yes. Practically she came to us some times ago with some skin rashes, and due to the widespread nature of the rashes, we were thinking that be something more. So that's why we took a sample the last time for
I think
HIV
at
tests.
the
I don't know if you
moment
have heard about
we've left the scope of this discussion. We can start another counseling session after you've completed one.
I didn't hear that.
Maybe, Doctor. I said you're starting a second counseling station. You've completed
Yeah,
your
because
counseling. You cannot bring the husband and start again.
because the next question was asking me how to tell the wife about the state of the tell the husband about the state of the wife. So is that aspect I am now?
Was that part of the question?
Yes, sir.
Okay.
Go back to the question, Dr. Ojo.
Yes, sir. That's the big question. So the question B reads, how will you inform the husband about the status of the wife? Then before I'll now talk about the anxiety of the other wives and family members.
So the questions are a bit okay. Even if you bring in the husband and answer question B, how would you answer question C?
I will answer question C. After I discuss with the husband, I will also let the husband know that the other wives, because definitely since the husband is aware, it's supposed that the other wives, other members of the family will also be aware. And the general thing that they will be anxious, they do want to move close to her, and they want to. So I will just tell them that the virus is not spread by staying close or moving close to the one that is infected. And I also tell them that they also need to be tested, and if they are negative, they need to welcome her.
Sorry, Dr. Joe, the point I'm making is that the other family members are not there.
Okay, sir.
So how are you going to tell them?
Yeah, it sounds like the examiners are going to ask you a question. How would you go about telling the husband? You're not supposed to describe how the husband will find out.
Yes, I think so. So I think you should round up with her, Dr. Joe, and then
okay, sir.
Subsequently we can discuss more.
Okay, sir. Okay, sir. So just to wrap up, so I will also be linking up with our heart-to-heart clinic. We'll give you some leaflets and to read about HIV. Then also we'll immediately after we've done your test, we'll commence your medications, which I will advise that you'll be compliant with medications and be following you up after that. Is that okay?
Okay, will I start these drugs today?
You said?
Will I start the drugs today? I'm ready.
Yes, once we run the test, we'll start the medication immediately. Once we do test, then we'll run the test to know the level of the virus and also to check the immune cells. Then we'll just check you check your blood count also and everything. Then we'll start the medication immediately after the test.
Okay, thank you, doctor.
Then I'll also give you an appointment that we can discuss further. I'll also link you up with our social workers. Is that okay?
Okay, thank you, doctor. It's okay.
All right. Thank you very much. Thank you very much.
Thank you.
Okay. Sir, can I go ahead? Okay.
Please go ahead, Dr. Ekele.
Okay, thank you so much, Dr. Ojo, for the beautiful presentation. Thank you so much. Okay, so now we'll take comments and questions from the participants first, then our teachers will come in. Okay, so we have a lot of hands up. That's very good. I don't know, can I just say my one concern before the others come up? Okay, thank you so much. I think you did very well. You followed the Spikes model, and I just love the way you went. You didn't talk about her bringing her children for testing. And then I'm very concerned about the time. I don't know whether it's actually 10 minutes in the exam. I think I'm just worried about the whole time management. Is it actually 10 minutes?
Time
10 minutes is actually enough time. It's actually, I think it's 12, between 10 and 12. But
It's 10, it's 10. It's enough
it's
time.
10. It's the where about 10 minutes is way enough time. You will have finished your counseling, you'll be gisting with the patient there.
Yeah, because he used almost 20 minutes.
I know.
That's bad.
It's all about time management and focus towards what you want.
Okay. Okay, so Dr.
I
Adeyemo.
remember I can't station as far as ordering an Uber for my patient to come, just to tell you the amount of time I had.
Okay, sir. Okay, Dr. Adeyemo, go ahead.
Thank you so much, Dr. Ojo. Thank you for the beautiful presentation. Good morning, our facilitators and students. It was actually a very good presentation, but I just want to make some clarifications and also add some things to the presentation. Actually, I think this is actually a Breaking Bad News station. It's a station that has to do with the Breaking Bad News. One of the things we are told, I think, even at the level of part one, is that you still reconfirm the biodata of this patient. So it's also very important that why before setting up of that interview, we should still try as much as possible to still reconfirm the biodata of the patients. Then, apart from that, the breaking the bad news should be done in two layers. The first layer is when you talk about that you do not have a very good news for the patient, you are afraid you don't have good news for the patient. And the second layer, when you now want to tell the patient about that particular bad news. I noticed that you asked the husband to go out, but when you wanted to break the bad news to the woman, you did not ask the woman if she would like someone to be there again. Why you want to break that bad news? It's also very important for support, for emotional support as well as emotional help. It's important that we ask if she wants to, but if she now denies, or sorry, if she doesn't want anybody to be there, fine, and I'll go ahead with the second layer of breaking the bad news to the woman. And that since this is actually a Breaking Bad News station, I was thinking that there should be a form of voice modulation, like the way your voice was when you started was almost the same way your voice was when you ended. So I think there should be some forms of modulation of the tone of voice when, especially at the point when you eventually broke the bad news. And then when the news was broken to the woman, there should be some phase of pause so that you allow the woman, you allow the information to sink into the woman, allow her to express her emotions as well. And apart from that, there was a question she asked when the husband was there. She said that I hope everything is okay. So you say everything is fine, that there is no problem. So I think that is actually not incongruent with the news you actually wanted to break. I'm not saying that you should say everything is fine, but at least probably one should find a way of shying away from answering that question because part of the Breaking Bad news is that we should not give the patient some forms of false information. The patient was actually coming to know what the result of the test was, and she asked that I hope everything is fine, and the thing was that everything was fine. And then the next phase, they are saying that it's positive for HIV. It's not the palatable news. So I think probably you should find a way of shying away from asking that kind of question. But it's very important to modulate the voice while breaking bad news. Thank you, Dr. Ojo, for the beautiful presentation.
Thank you so much, Dr. Adeyemo. Okay, Dr. Kalabamba, go ahead.
Okay, thank you so much, Dr. Ojo. That was a brilliant attempt. Okay, just an add-on. Okay, I think what the previous person just talked about was that you didn't show like any form of empathy, and then you didn't allow her to grieve. It's not really a good news. Maybe you'd have allowed her a bit, tell her some sorry, make her have some sense of belonging and all. Then again, so I want to find out, is it advisable to let her husband know immediately? Or maybe on follow-up visits, you can actually tell him, knowing fully well that she's not just the only wife, and then he may go and maybe let the other wives know about her status. Do we tell him immediately or maybe on follow-up visits? Then also for the Also for the relatives, I don't know if it is advisable to tell them about her status because, most times it's contracted from maybe blood, sharing of sharps. Maybe she can also be very careful about sharing sharps with them. I don't know whether going about telling them about her status, won't it stigmatize her? Or is it not just best maybe we just do a routine retroviral screenings for them than letting them know about her status? Because most times it brings stigmatization, maybe for the sake of her privacy. Then also, Dr. Ojo, I want to find out which principles of the ethical principles, which did you apply for this patient while breaking the bad news to her? The principles of ethics, what did you apply here for her? Hello, Dr. Ojo.
Dr. Ojo. Dr. Robert, come, please, can you mute?
He said he was locked out.
Okay.
Okay. So let's be taking Dr. Owal's comments.
Okay, then again, the consents. Most times in exams, most times these the simulators, they have consents. They have up to 3-4 consents, and that attracts a lot of marks. I didn't really hear him asking what are your consents. He didn't really address her consents to attract marks for him. And then I didn't really hear him ask her to recollect, to recap what he had previously stated, whether she understood all that he told her. So that's all I have to say. Otherwise, it was an excellent one. Thank you.
Thanks so much. Okay, sit back. Dr. Tom, please, can you mute? Okay, Dr. Joe was locked out. Now, please, can you let him back in? Dr. Owal.
I've let him back in already. I think it's his network.
Okay. Yeah, okay, Dr. Owal.
Okay, thank you very much, Dr. Ojon. Good morning, my teachers and colleagues. Thank you for the presentation. It's actually a very good attempt. I'm still by the comment of my previous colleagues. And in addition, I think this is an exam and we have to be mindful of the time. I think the way you conducted the thing, it's like you are not very mindful of the time. It's good if you ask her the ways that she knows how HIV can be contracted, and she told you that it's through sex. So maybe because of time, you don't have to start asking her again, have you had blood transfusion before? Are you using sharp needles? Blah, 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 blah. You should just go ahead and because that's what she knows. So you just go ahead and tell her, okay, other ways to contract HIV can be A, B, C, D, E, like that, so that you just go over them and then move again. And then a little about the sequence that you follow. You are breaking bad news and the outcome can be positive or negative. So I think for this one, you should tell her that, okay, you have done this test and this test can turn out to be negative. If it is negative, what we do is to encourage you to maintain your status for being negative. However, if it is positive, that's not going to be the end of life because so many patients have HIV now. In fact, there are many other chronic conditions. Just to give her hope in case it turns out to be positive eventually when you tell her that there are many chronic conditions that are now more deadly, more troublesome than HIV. A lot of people are living with HIV and then they live almost close to normal life. And the good news about it, even if it is positive, drugs are available that can contain the virus. And then these drugs are even free, that patient can access this drug from clinic free, and then you follow your condition there. And then also, because she's a very young lady, she's 35 years, so definitely issue of reproduction should be there. And then she would start thinking definitely that, okay, how will I live my reproductive life? Can my child get this thing? You still tell her before you tell that she can even conceive, she can have a very good pregnancy, and then there are methods now that she can follow, and then she can deliver a negative baby, and then you later on tell her that after breaking the news, then you tell her that you run a confirmatory test. I thought you would have definitely run a confirmatory test for a test like this before you eventually tell a person that is positive. So definitely you have done a test, you have confirmed the test, you are very sure that what you are telling her that is positive is actually positive. Because now if you tell me that I am positive and then you are telling me that you are running a confirmatory test and then later you confirm, you find out that it's negative and then you are telling me that it's negative, I think that would not be funny. But by and large, it's a very good attempt. Thank you very much.
Thank you so much, Dr. Owa. Please, Dr. Rita Okama, I saw your hand up. I don't know if you still want to talk.
Good morning, teachers. Good morning, colleagues, senior colleagues, and all that. Thank you for the brilliant presentation, Dr. Ojo. I think most of my questions and comments have been addressed. Like initially, the husband, like said earlier on, that the husband, I think it should be later on, for the second visit after the confirmation. Then in terms of the family member, I think it's also going to be after the confirmatory. I think after the confirmatory test, like others have commented. Thank you for the wonderful attempt of presenting this patient. Thank you of this question. Thank you very much.
So much, Dr. Rita. Thank you so much. Okay, Dr. Mohammed, I think lastly.
Good morning. Thank you, Dr. Ojo, for the presentation. Good morning, my teachers and senior colleagues. And I have a little concern because this next question asks, how will you disclose to the husband? I don't know either the trend is changing. Initially, it's always to encourage the patient herself or the client. Do you want any other family member to know, or who do you want to be informed? Or even her husband is encouraged that we should tell her herself to tell the patient, or either she'll request for our input. Doctor, I wouldn't mind. Please go ahead and tell my husband. Instead of we ourselves just calling the husband and start telling him, your wife is having this and that. And I think it's the wife that should be encouraged to do that, or for her to give her consent for us to do that. And also the client asks a specific question, maybe because she is anxious that, doctor, please, can I start the medication today? But like Dr. Ojo shying away from that, we need to do some baseline. Yes, you can encourage her. Yes, there's no problem. We can start your medication, but I'm afraid you can't start it today because we need to run some baseline investigation before you start your treatment. But not just telling her that, yes, we do baseline. When are we getting our result for the baseline? Because for her, she wants to start the drug that very day. And then issue of inviting her children also need to be screened. We have to tell her this, and we have to further explain to her that those rashes as a result of the immunosuppression due to the HIV that she has, what looks like molluscum contagiosum. Thank you very much, but it's a wonderful presentation. Thank you.
Thank you so much, Dr. Mustafa. Okay, so for time's sake, I want to read the comments on the chat. Please, can we just read it? Thanks so much, everyone that dropped a comment. Thanks, everyone, for your contributions. Okay, I'll hand over to our teachers. Christabel.
Oh, thank you so much, Dr. Ojo. Thank you. Let me quickly make my comment. I know once Dr. Remigus and Dr. Chitu comes, the class is closed. Let me make my comments quickly. I must appreciate Dr. Ojo, the way you organized the whole thing, got the husband, got the wife, and he prepared. But what he did not prepare for was time management. So it was a wonderful attempt, but we'll keep talking about time. Please, we usually tell you that since they give you 10 minutes in the exam, practice with 8 or 6, just to be sure. And I remember when we went for our exam, in fact, I think on my stations, really, I had time. It was even when I was busy gisting with the examiner. I knew him before now. I waited after I finished my question. I will not say gisting. When I got to my counseling station, I remember clearly, I told the guy to repeat what I've said. I think up to like three times. It was the third time. There was something he said. I think the guy wanted to just help me. That did not make sense to me. I said, I didn't say that thing to you. Oh, sorry, not vex. I quickly changed it. So that's why most time, just focus on the question they give you. Don't start going to Lagos, Abuja. Focus. Once they're giving a question, ask yourself, what is my role here? What am I supposed to do? And focus on the question. And if you focus on the question, you find that you have a lot of time. Nobody wants to diagnose. Patient is diagnosed already. It's to break the bad news. I think I must appreciate all the commenters, Damon Ward, Dr. Awa, Dr. Rita, and Dr. Kalamama, as always. I must appreciate the commenters. They've made our job really easy. Thank you so much for those comments. Breaking bad news. You don't release it like that. It's okay, there's good news, there's bad news. Which one, try to be really empathic with these patients. There's this change of voices too. Counseling is like acting. You need to act. Those that know me, me personally, I'm an introvert. I don't know how, but I have to learn to act. I have to learn to speak. Sometimes I look at the mirror and say, do I have the right expression? Or somebody that is sympathetic. So your expression, everything. And this lady was busy crying. You didn't even say, oh, sorry, nothing. Just continue your gist. So and these are the things they watch. If somebody is crying, next thing is say, please. And during the moment, you need handkerchief. Even though you just during the moment to just relax. Those are the things that give you mark, not stuff. Not stuff. They want to know, are you sensitive to this person's emotion? Are you looking at this person? And one thing I'm also saying is that, please, the simulators are not this nice. Dr. Hart, she's so nice. They're not this nice. I know for this particular station, the person they brought, she was almost like a mute. So I think for those that went for the exam, they told us how it was. It was quite a horrible experience for them. Said the woman was like a mute. Anything, doctor, whatever you want. Doctor, whatever you want. Doctor, do what you should do. Okay, doctor. So she was almost like a mute. And I have come to realize these are the type of people they bring. Like they are trained to be mean. And they check them occasionally to be sure they're not giving out any clues. They're not being nice. So don't expect niceness so that you will not be taken aback, please. They're not usually nice. Please. Sometimes they can frustrate you, but do not give up. Keep trying. Just focus on the question. Keep asking the right question. Keep asking them to tell you their concern. Keep asking them to repeat what you have said. That way you begin to sift out what you should sift out and quickly redeem yourself before the time ends. I think there are a lot of stuff, but let me not finish everything. Chief Chitu, Chief Remigus, I know they have Chief Cookie too, and other facilitators. I know they have a lot of things to add. Ajibola is also in class, so I had to. Chief, sir.
Yeah, I don't know. Anytime there is a counseling session like this, if I will end up doing only because it's usually very interesting and there are usually a lot of things to say. So let me just quickly, a lot has been said already, but I must commend the presenter, Dr. Joe. It was a very fantastic attempt. If I was the one manning the station, I think he would pass. Although apart from the time that he took, if he did what he did within the limited time, okay, so within the time limits given. So, but I just want to stress that it's important that we do these things every day on the ward round. It's not just about practicing because of exams. If you do it every day on the ward round, I guarantee you will not have a problem in the exams. Now, every day you are doing the ward round, there is bad news to break. Every single day. Creatinine is elevated, is bad news. The patient is on your ward and hepatitis B virus is positive. That's bad news that you have to break. The fact that someone is even admitted on itself is bad news. The fact that someone does not even have money to pay for one test you have requested for is bad news. The fact that you have to request for that test is bad news to that patient. And you have to break it with empathy. You have to make them understand that you understand what they are going through. Or in fact, it's difficult to understand, but you can imagine what they may be going through because it's difficult to understand what someone else is going through. But you can imagine what they may be. I guarantee you to become a part of you. You'll do it faster. In fact, I try to do this every single day on the ward round. So I don't want to add so much to what everyone has been saying, but even I still have some confusion about the second question and the third question. I think the way he was able to excuse the husband was good. Now, I know one of the people, one of the other participants talked about calling or asking her if she wants the husband to come in when he wanted to break the bad news proper. Yeah, it's actually appropriate. But the point here is this particular situation is one that has stigma attached to it. So it's important for her to know the nature of the bad news before you start asking her if she wants someone to be there. Because if you say, do you want your husband, when she doesn't know the nature of the news, she can just say yes. But by the time you now break the bad news in front of the husband, it might become a problem. But of course, it's good to always find out there, because when somebody has a support network, when you are breaking bad news, it's always better. It's always better. Because if they want to cry, there's someone to hold their hands, hold their shoulder. But just imagine you wanted someone to hold their hands when you break the bad news. And instead, what you get is somebody that said, what? Where did you get that from? I thought I divorced you. Just imagine that. Okay? So what you wanted to achieve was someone that will hold their hands and tell them sorry. Emotional support when you break the bad news. But imagine a situation where it is that same person that will now cause more grief when you break the bad news. So one has to be careful in this kind of situation. Okay, so but maybe you can give her the news a little and ask her, do you want me to call in your husband? Will you feel better? You know? But again, if you do this every time, even that modulation of voice, you won't even know it to be effortless. The way you talk, the way you empathize, to be an effortless thing if you do it, if you practice it every day. Thank you.
Thank you, sir. Chief Chitu, sir, thank you so much.
Yes, good morning, Dr. Christabel, Dr. Kelly, and you had the steps all locked down, but you made it sound a little bit theoretical because you were following the steps one by one. And many a times, counseling stations, you have to think on your feet. You need to ask yourself several questions when you're doing a counseling station. I think the other people have pointed out a lot of things, making sure you have the right person in front of you, of course, setting the scene. Now, setting the scene here is not like other counseling stations where the person may want somebody else around or may need somebody else around for emotional support and all of that. Now, this particular one is a little bit on the dicier side. Now, but there's a cheat mode to this. Now, before someone does a HIV test, they will have had a pre-test counseling. So you just simply ask, before they did the test, did anybody talk to you? If the answer is yes, was your husband there when this person spoke to you? And the person will say, if she says no, then you cannot continue with the post-test counseling if the husband was not there at the pre-test counseling. So the husband will have to go. But if the husband was there at the pre-test counseling, then he's been brought up to speed about what's going on. So he's aware that the test like that was done and the possible implications of that particular test. So yes, you can, if she says she wants him there, he can remain. But please do not ask her the question of whether you want the husband there or not until you are sure of what happened in the pre-test counseling. Okay? Because if you just ask her and say, I don't want, do you want your husband there? The husband is in front of you already. What do you think she's most likely going to say? She's not going to say no now. She's going to say yes. Because he doesn't want wahala. And that's where you have to think on your feet. So now you circumvent this by being the one to excuse the husband and let it not be the wife herself that is excusing the husband. Okay? Now, the other thing I want to point out is in breaking bad news, okay, I would say there is no particular way of doing it. It depends on the circumstance. In this particular one, the bad news here is, to many people, is very bad news. Some people may even think this is worse than cancer. because the social implications, the physical implications, and all of that, will weigh on the patient. And of course, we do know how it has been publicized over the years. So the ideal thing here is not to just break the information to the patient. What you want to do is, after you find out if there was a pretext counseling of some sort. No, yeah, I didn't mention that. If there was no pretext counseling at all, the person just had blood tests done, okay, which of course is wrong, okay, then you may have to excuse the husband so that you can discuss everything in and around it and finish off, okay? Now, back to what I was saying before. Now, many a times when we want to break bad news, it's either you tell the person something like, oh, I have good news and I have not so good news. Please try and avoid using the word bad. Okay? I have good news, I have not so good news. Which one would you like to hear first? Of course, people will say, I want to hear the bad news first, and people will say, I want to hear the good news first. Now, that is if there was a pre-test counseling. Now, if there was no pre-test counseling, it means that you have to now do the pre-test counseling. Okay? And of course, the pre-test counseling is everything, right? You telling the person what the test is about, what you're testing for, what are the implications of a positive test or negative test, how was that thing gotten, all those type of many things. Okay, but the pre-test counseling, you can now ask her what she got from it, her own perception from it. Okay, and then you just plug up any loose ends from that. Now, once you've done the pre-test counseling, right? If you're going to do the whole pre-test counseling, before you say good or bad news, you tell her the implications of a positive test and implications of a negative test. So the person's mind is at ease that, oh, before I can tell you your result, I would want to tell you, that this particular test was a test for this, and these are what will happen if you are positive. This is what will happen if you're negative. Now, because you're negative does not mean that you're totally exonerated. It means that you just have to start taking things more, stop taking things lightly. And you want a situation where you want the person to be able to understand the implications of picking up the infection later on and things, okay? So yes, there's a higher chance of contacting the virus if there is unsafe practices within the family. Now, once you're done with all that gist, then you can now move on to the good news and the bad news. Now, she will now tell you, okay, I want to get the good news, or I want to get the bad news first. Of course, the bad news here is that there's HIV in a test came out positive with HIV. And the bad news is, the good news here is that, yes, it's something that can be managed, okay? And all of that. And then you went through the whole thing, and all of that. I'll say your simulator was very nice. If I was the one that was your simulator, I'll probably be wailing and crying and blaming everybody. And you have to do a lot of work to calm me down. That's the truth. Because honestly, that is what you get if somebody has not been well pre-cancer. Okay? Now, once you're done with all of that, you have the other thing to deal with. A husband is outside, okay? If you sent him out. If the husband is with you there, yes, both of them would have gone through the rigmarole together. Then you have to tell her that, look, this particular problem is something that you can spread on to other people. Other people are at risk, okay? The other wives at home, the husband. And then at the same time, it is possible that it came from that end. Now, you cannot tell her which of them happened. There's no way to determine it. But the only way to find out if everybody is okay is that everybody must come in for a test. Okay? So everybody needs to come in for a test. Now, you do not have to reveal it yet. I would say it is easier to get the other people tested. But the problem there is that they will ask you, why are you testing us for this particular thing? So that's where the husband comes in. You may have to organize an audience between her and the husband and yourself, where the news has to be broken. Now, she may need the support to do it. She may do it by herself, but you want to help her create a safe space for that result to be divulged. A safe space, not that the husband is going to beat her or anything, no. A safe space in that she may need somebody that would do a better explanation to the husband, so that the husband does not think that, oh, she was sleeping outside or something. No, so that the person can state out, oh, these are the possible ways that it may have come. Okay, and that the fact that you cannot really pick out what way it came in, and the fact that, look, it may not even be her that is the source of it. It may just be her that manifested the symptoms first. So one of the other wives may have been the one, okay, or even he himself. All right, so you create that safe space for that information to be broken. Now, for the other wives, it may be difficult after you tell the husband. You can't just tell them to go and break the news to them. What you may want to do is test each of the wives. And if the husband has brought speed, he can be the one in those people to run their tests as well, without divulging the information about the other wife. We'll say, oh, I'm going for a test. I want everybody to do the test. Okay? And even take the original wife, the person that was tested initially, all of them will go together to the hospital, like they're all doing tests together. So that way, there is no blaming or hand pointing that anybody did anything, because the husband has been brought up to speed and then everybody was tested at the same time. So it's almost like everybody found out at the same time. So that way you divulge any issues or scatter any issues that may want to develop within that particular household. But please take note that the person you're counseling is the most important person, because that's your patient. Okay, until the others test positive or have their test done, they now also become your patient. But you need to protect the interest of your index patient, which is this particular woman. Okay, I hope this has been able to sort one or two issues out. Yeah. Dr. Christopher, over to you.
Oh, thank you, sir. Thank you, sir. Dr. Dahatu, I don't know if you have any comment. Your hand is up.
Okay. Right. Thank you, ma. Good morning, senior colleagues.
Thank you.
Just like what Dr. Shitu mentioned, so to win the husband at the beginning. So after the husband has been counseled well and he agreed with that. So the way the program is run now, there are a community facilitators like that they move into community to counsel patients even at home. So what we do in the program these days, so we just organize small outreach. So where the husband will tell us the house where he's living. So the hospital now will set it in such a way that about 5 to 10 houses that are surrounding the house, they want to go there to introduce the topic to them and counsel them. So because we already agree with the husband, when we get to his house, he's going to agree. So we just see the other ones, if we are able to, for them to agree with the counseling and testing, we test them. So the family will now see it that it's not only their house we visited. We visited the house before them, we visited the house after them, and the house nearby. In that way, we'll be able to screen the whole family, and those that are positive, then they will be counseled adequately and start on treatment. And those that doesn't have the disease will now be giving preventive measures. This is one of the situations that I managed this week on Monday. Similar to that, but we are here to visit the family. But I think by next week we'll try and see the family. For that one is the wife that came with positive results. The husband is not aware. The two wives are also not aware. Thank you very much.
Thank you, Dr. Dahatu. Thank you so much. Thank you. I also appreciate the presenter, Dr. Kafo, Dr. Hart. Thank you for volunteering to support Dr. Ojo. Thank you so much. All the comments, they're all